One of the most confusing statistics we talk about with coronavirus has to do with how many ICU beds are in use and how many are available. For our Tuesday update on COVID around the state, Fox 13's Max Roth tracked down some numbers to give us a clearer picture.
ICU numbers have been confusing to me too because we get a lot of them and they don't always sound that troubling. For example, today's numbers show Utah's ICUs have 177 COVID patients and 442 total patients. Now that puts us at 84% capacity. That doesn't sound so bad. But I spent some time today with numbers from the U.S. Department of Health and Human Services and the Utah Department of Health and found three kinds of ICU capacity. First, there are beds. We have a lot more of those than we actually need right now. 1,036 from south to north, with most along the Wasatch Front. But beds aren't the important thing. Real staffed capacity for adults is 623. That's because, one, IHC has built a bunch of new hospitals that can expand capacity as population grows. And two, some are for children who, thank goodness, don't need them as much. 623 beds is still a lot when you remember the last figures show 442 patients in Utah ICUs. But when it comes to saving the lives most in danger, cut another 27% of those beds away. They are in small, less specialized hospitals. Utah's big, specialized, so-called referral hospitals have 453 ICU beds staffed. And the busiest of those, the University and Intermountain Medical Center, are in regular danger of exceeding their capacity. The Utah Department of Health outlined this really clearly in a paper earlier in the pandemic. ICU capacity is about trained staff and not those beds, especially because COVID-19 taxes the skills of that staff with its attack on any number of key systems in the body.